Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the OCTA Research Group sees a decline in Metro Manila's new COVID-19 cases, but a doctors group warns the public from being complacent as hospitals remain full. The government has yet to decide on giving booster shots to medical frontliners, and lawmakers are questioning the proposed 2022 budget for lack of funds in COVID-19 response. Senator Nancy Binay joins us live. Metro Manila's new COVID-19 cases are on a downward trend, according to OCTA Research Group. The group says that the National Capital Region's weekly growth decreased to negative 20%, while the reproduction rate is now below 1% as of September 22. Despite this, the Philippine College of Physicians says that the decrease in cases can be attributed to the strict quarantine measures in the last few weeks. The doctors group adds hospitals remain full with COVID-19 patients. Let's go straight to the source of the story. We have Senator Nancy Binay. Senator, welcome to the source. Maraming salamat po sa inyong oras.
Magandang umaga, Pinky, and magandang umaga sa lahat ng nanonood sa The Source.
Pag-usapan po natin yung, I know, of course, this hits close to home sa inyo, no, sa inyong pamilya. A couple of weeks ago, your mom tested positive and the whole family had to isolate. But a bit of good news, according to the OCTA Research Group, dahil kahit na po 17,000 cases tayo kahapon, that was recorded yesterday, yung reproduction number has gone down to less than 1%. Pero sabi po ng Philippine College of Physicians, mag-ingat pa rin dahil punong-puno pa rin ang mga ospital. What are your thoughts on the progress of the weeks from ECQ, MECQ, and then now to alert level 4 with granular lockdowns?
Well, for me, syempre, Pinky, welcome development. The numbers are going down, but we should also remember na this is because of ECQ. This is not because of the alert level. So, para sa akin, kasi narinig ko kanina si Yusek Densing na since bumababa na, mukhang pinag-uusapan na naman yung pagluluwag. And ang parang dahilan niya is, for him, successful na itong alert level. But the cause kung bakit bumababa is not the alert level but it's the ECQ. So sa akin talagang dapat kumbaga let us be cautious about opening up.
Huwag muna tayong magbukas para po sa inyo, Senator. At for you, obviously, hindi pa nagre-reflect itong alert level 4 with granular lockdowns.
And sa akin siguro, Pinky, okay lang naman magbukas tayo dahan-dahan. But as of now, yung pagsasara natin, walang kaakibat na free testing, contact tracing di ba? For as long as we don't have that, mahihirapan tayong to sustain our opening up. We will still end up yung close open kasi nga yung protocols like free testing, wala doon.
It's good to talk about that, especially later on during our interview, because I know that you have been looking into the 2022 budget of the government. And ang sabi mo nga, doon sa mga nakita ninyo so far, dapat unahin itong COVID response. But I just want to stick to the COVID numbers right now. No? Face shield. Sinabi na po ni Pangulo na hindi na po kailangan ng face shield dun sa 3Cs na tinatawag. In reports yesterday na lumabas, dahil kahapon po lumabas yung balita, marami pa rin pong nalilito. Kasi pag naglalakad ka, pwede nang hindi ka mag-face shield. Pero pag pumasok ka ng mall, obviously, dahil closed part yun ng 3Cs, ay kailangan suotin ng face shield. Ano ho ba ang inyong stand dito sa face shield? And was it a good idea na tanggalin na to in certain areas?
Ako kasi Pinky, together with my other colleagues, matagal na namin kino-question tong pagiging mandatory na pagsuot ng face shield. I guess kumbaga welcome development na din kahit may kulatilya yung pagsusuot or pag hindi suot ng face shield. But for me, going back to the same problem paulit-ulit, ang gulo kasi ng messaging natin, 'di ba? Kaya yung mga kababayan natin, nalilito na rin sila kung ano ba yung health protocols na susundin nila when it comes to COVID dahil katulad nga na nabanggit mo, yung pagsusuot ng face shield, parang ang consistent lang is the inconsistency, diba? Yung pwede mong suot, hindi mo pwedeng suotin in public places, pero I assume pagpasok mo sa bus, kailangan mo na naman suotin. So at the end of the day, kailangan pa rin bumili ng ating mga kababayan ng face shield, which for us, mukhang hindi naman kailangan kasi nga, di ba, paulit-ulit na sinasabi, tayo lang ata yung bansa na nagre-require ng face shield.
Limited face-to-face classes, Senator, para po sa inyo, of course, wala pang specific date on when this will be implemented, pero binigay na po ng go signal. One concern, if you talk to people and look at social media, is that hindi po kasi nagiging mandatory for teachers to be vaccinated. Do you think that is wise? Considering kayo po, meron ho kayong mga anak.
Well, we've discussed this sa committee ni Senator Sherwin Gatchalian, and we've been asking DepEd, labas nyo na yung protocol para din malaman ng ating mga kababayan kung ano ba yung magiging rules when it comes to face-to-face. Well, number one, I don't agree na hindi dapat kailangan na bakunado yung mga teachers natin. During the last hearing namin, we in fact asked DepEd kung ano na yung percentage ng nababakunahan sa mga teachers. And sad to say, they couldn't give us a number. Kaya nga, I raised an issue na parang, bakit parang wala tayong naririnig from DepEd na talagang pinaglalaban nila yung mga teachers natin to avail of the vaccine or to make it available to them, diba? Kung hindi nila alam kung ilan na yung nababakunahan, for me, talaga mababahala ako as a parent. Siyempre, kung gusto ko na magkaroon ng face-to-face, isa dun sa protection yung for both the students and the teacher, yung pagkakaroon ng vaccine.
So, para po sa inyo, dapat ho ba mandatory ang vaccination for teachers na mangunguna po dito sa limited face-to-face?
I think dapat mandatory doon sa mag-face-to-face. Unang-una, konti lang naman tong pilot testing. Remember, Pinky, pilot testing muna tayo. So I think dapat talaga gawing protocol na mandatory na vaccinated yung teachers natin na magiging bahagi ng pilot face-to-face. But more than that, I think our teachers deserve access to COVID-19 vaccines. Kaya dapat yung DepEd ipaglaban sila sa IATF na kumbaga kasama sila dun sa priority na mabibigyan.
Yeah. I guess it comes to mind also, certain industries that want to open or have open. For example, the Department of Tourism, you have Secretary Berna Romulo, very proud, saying that so many of the of the employees, workers rather employed in the tourism department have been vaccinated. So I'm assuming ganun din po yung gusto niyo sana marinig sa DepEd.
Yes, and Pinky, hanggang ngayon, parang wala pa tayong naririnig na gano'n doon sa DepEd, di ba? In fact, ang naririnig natin, hindi mandatory yung vaccination, which brings us to question na baka nga mababa yung vaccination rate ng ating mga teachers.
But ano po yung sagot nila? Bakit walang datos doon sa mga number of teachers who have been vaccinated, considering that this discussion or this proposal of pilot limited face-to-face classes has been on the table that the president had denied in the past?
Actually, yung sagot nga during the hearing, the answer was I think they're gonna collate pa the data. But hopefully during their budget deliberation, mabibigyan na tayo ng percentage kung ilan talaga dun sa mga public school teachers natin ang vaccinated. But more than that, kasi nga din, Pinky, ang tagal na namin pinag-uusapan sa Senado itong face-to-face classes. And we told them na hindi naman to overnight mai-implement, di ba? It involves certain retrofitting, di ba? Yung mga eskwelahan na gagamitin dito sa pilot testing. Kailangan i-check or baka kailangan ayusin para well-ventilated siya. Kung walang access to water, baka kailangan ayusin yon. So, dapat, kumbaga, a few months ago, kahit wala pang go signal coming from the President, in place na yung mga ganong requirements. And dapat, during this time, yung mga ganong facilities ready and available na dun sa mga napili nila na schools for pilot testing.
There is also just on a related subject kasi nga sabi po ni Secretary Galvez that hopefully by mid-October uumpisahan na sana or the goal is to be able to start the vaccination of the 12 to 17-year-old students. Do you think that masyado po, or are you happy with this kind of pace na hopefully mid-October, that's not with no certainty, or do you think dapat buksan na po yung vaccination to the general public which they plan naman in November?
Siguro baka mas maganda, Pinky, nga i-open na lang to the general public. Kasama na dun yung 12 to 17 as part of the general public. Kasi nga, I think si World Health Organization, nababahala pa din sila kasi marami tayong mga senior citizens na at the moment parang hindi pa din nababakunahan. So, isang concern din yan. But for me, mas maigi siguro na i-open na lang to the general public itong vaccination program natin. But balikan ko lang, Pinky, doon sa limited face-to-face, doon din sa hearing namin sa Senado, isa pang nakakabahala. We found out na DepEd was not coordinating with the private schools when it comes to limited face-to-face. Alam naman natin, yung mga private schools, meron din silang different set of rules, di ba? Well, hopefully, siguro sana naman ngayon nakapag-usap na sila kung paano din magbubukas itong mga private schools natin.
May I find out the reason they gave why they did not coordinate with the private schools?
Wala Wala silang binigay na dahilan. In fact, during that hearing, doon lang, kumbaga, nag-appeal itong Cocopeya na kung pwede, upuan din sila and bigyan sila ng different set of rules when it comes to limited face-to-face. Alam naman natin yung mga private schools, they can afford to have more open spaces. In fact, ang ganda nga isa nilang suggestion na baka pwede to open up certain facilities dun sa mga private schools. Like for example, yung library, baka pwedeng gawin by schedule yung mga estudyante. They can visit the library or yung mga laboratory or yung gym nila for them to do certain exercise, di ba? Yung mga ganong detalya which hindi nga sila nag-uusap.
I remember one part of that hearing, Senator, na not these exact words, but you really questioned na bakit parang hindi pa kayo prepared.
Yes, and then
Referring
parang
to the
there's no
DepEd.
sense of urgency. Imagine, Pinky, in the whole, sa buong mundo, I think by the end of the month, tayo na lang yung hindi nagbubukas. Nung hearing namin a few months ago, 5 yung hindi pa nag-open. But by next month, tayo na lang yung hindi nag-open because I think Venezuela will open by October. Tayo at the moment, wala pa nga exact date kung kailan tayo magbubukas.
Last I saw, it's supposed to be the Philippines and Venezuela na hindi pa po nagkakaroon ng face-to-face classes. Mauunahan na pala po tayo ng Venezuela.
Yes.
All right, we need to take a very short break. Let's talk about the budget because you had mentioned dapat ang ipinaprioritize dito ay ang COVID response for 2022. We will be talking about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Senator Nancy Binay. So balikan ko po yung 2022 budget. You had a lot of questions here. And you said, bakit ganon? Parang hindi natin pinaprioritize ang COVID response para sa susunod na taon. And even earlier during the show, sabi nyo nga po, itong mga pagbukas at pagsara ng ekonomiya natin is not going to work. Kailangan meron tayong testing, contact tracing, isolation and treatment. Very important. I know that you mentioned bakit nawala yung budget sa contact tracing. What did you find out?
Well, during the DBCC briefing, in fact, si Secretary Chua said na ang premise nila for next year's budget was COVID will not go away anytime soon. So with that pronouncement, we expected na yung budget would address yung mga needs for COVID. And then when we asked about contact tracing, ang sabi nung taga-DBM, there's no budget for contact tracing. So we asked, bakit nawala? And then they said was kasi DILG daw didn't ask for it. So parang sa akin, just because hindi hiningi ng DILG, hindi yun yung man lang tinanong kung bakit wala tayong budget for contact tracing. And then wala, they just said kasi nga walang nag-request.
But how do we go about next year without a budget for
parang
contact
hindi nila
tracing?
inuupuan
Uh-huh.
para pag-usapan kung ano yung mga needs, di ba? Bakit kailangan or how come nobody even bothered to ask why there's none?
And how are we supposed to go about next year without a budget for contact tracing?
Well, I guess kasi hindi pa naman tapos yung budgeting process. Dito lalabas talaga yung power of the purse ng Senate to realign or reallocate certain funds for our COVID response. And I think may commitment naman yung aming chairman, si Senator Sani Angara, na mukhang maraming mababago dito sa 2022 budget because kulang nga yung response for COVID. Siguro cite ko na lang isang example like yung PCOO, they have this budget of 200 million for
their media hub.
Diba? Media hub. Now, which for me is not a priority for next year, right? So I am sure isa to siguro dun sa for the meantime siguro suspended muna itong project na to, and we'll see maybe sa 2023 kung if we're in a better position baka pwedeng ituloy, but at the moment I don't see the sense of urgency in building a media hub, a Visayas media hub.
Right. I did read about that, Senator. Kinwestiyon nyo nga ito, the Visayas Media Hub. Ang capital outlay is supposed to be 200 million. And in the reports that came out after, meron na ho kasing nagawa na media hub supposed to be in Mindanao that cost 340 million plus may 400 million pa for equipment. The point I'm trying to make here is the 200 million na capital outlay for the Visayas hub. That's just the start, kumbaga. Meron pa pong definitely na idadagdag dyan. Eventually, dahil kung pagbabasihan po natin yung media hub sa Mindanao, hindi ho halos pareho yung gagastusin na pera.
Yeah, in fact, dun sa Mindanao Media Hub, may kulang pa na 50 million yun 50 plus million. So they're also requesting for that budget for next year for operation of that Mindanao Media Hub. But isipin mo, Pinky, nakakalungkot yung RITM, which supposed to be, di ba, siya yung research natin for not just for COVID, but for other tropical diseases. Zero yung capital outlay nila for laboratory. So isipin mo yan na even if you wanted to augment, since zero yung nilagay sa kanila, hindi sila ma-augment. Buti na lang na nakita namin yan, and for sure malalagyan yung capital outlay budget ng RITM.
Iho ba, Senator, yung RITM, please correct me if I'm wrong, ang nabasa ko is nabawasan po yung kanilang budget ng 170 million?
170. Yes, 170 million. And every budget season, laging nagre-reklamo yan kasi nga lagi silang pinuputulan ng budget. In fact, nung na-discover yung polio na it's back, ano lang yan, sariling initiative ng RITM, kahit kulang yung budget nila, napansin nila na parang sandali, mukhang kulang itong surveillance. So parang on their own, they did their own surveillance. And doon nga nila na-discover na nakabalik na pala yung polio. So after that experience by RITM, I expected na every year tataas na yung budget nila. But ang nakakagulat for next year, nabawasan pa sila ng 170 million.
Can we expect hindi po matutuloy itong budget cut na 170 million sa RITM and in fact expect a reversal na aakyat pa o tataas pa po yung kanilang budget? Iyan po ba is something na ipaglalaban ninyo?
Yes, for me, if they need more than 170 million, I think we need to fund RITM. Kasi nga, kumbaga paulit-ulit ko sinasabi kasi Vicky, for me, we are at war with COVID. So we need to build our arsenal. For me, itong RITM, isa to dun sa, kumbaga, gagamitin natin in our fight against COVID. And other diseases, remember, meron pa rin tayo iba't ibang problema. We still have dengue, we still have yung mga cholera, and I think polio medyo na-control na siya, pero kailangan consistent yung surveillance para para hindi rin kumalat itong iba pang pwedeng problema natin aside from COVID.
There is, of course, also you were questioning itong cancer fund, and we need to talk about the NTF-LCAC fund for 2022 na umakyat pa po or tumaas yung kanilang budget to 29 billion. This year ho ata nasa 17 o 19 billion. Sa dami po na pinag-uusapan nating pera, minsan nakakalito na. But we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Senator Nancy Binay. Also, I read, ito pong sa Cancer Fund, kinagulat niyo po ito dahil parang sinasabi ninyo, wala bang plano para dito? In fact, in 2021, you institutionalized, you added or you put in a 620 million fund in the 2021 budget. Tapos pagkita niyo po sa 2022, zero ho ba yung lumabas na allotment dito?
Yes, because I guess isa yun dun sa flaw na budgeting process, Pinky, na yung mga institutional projects na nilagay ng Kongreso, parang in the next budget, automatic dinidelete nila. Kahit nakikita na nila na it's a worthy project. And in fact, itong cancer fund na to, bahagi yun ng batas na pinasa namin na kailangan talaga may line item for cancer fund. Kaya nagulat kami na for next year, naging zero ito. And I think ang explanation nila was sinama nila ito dun sa naka-lump sum na assistance to parang indigent or may ganun kasing item sa DOH budget wherein they provide assistance to patients.
Okay, pero maibabalik po ba ito? Malalagyan po ng pondo?
I think so. Kung totoo nga na isinama nila sa isang fund, Congress can just take it out from that fund and put it back dun sa line item na cancer
sa line.
fund.
Okay. NTF-LCAC, just a last note on this, a budget. Community pantry pa lang ho, sinabi nila dapat i-review na itong budget ng NTF-LCAC. Next year, yung budget na which was quite controversial, yung budget po nila this year, tataas pa po next year ng 20 to 29 billion. Ano ho ba ang inyong plano dito?
I think, even last year, even for this year's budget, I already introduced an amendment na tapyasan itong budget for NTF-LCAC. Kasi nga, during the budget deliberation, I noticed na meron dong kasi I noticed na parang may pwedeng magkaroon ng double budgeting. For example, isa dun sa project na pwede sa NTF-LCAC yung school building. Ang DepEd, meron din silang project called Last Mile Schools. So when I asked for the listing, may mga lugar doon na parang same barangay yung tina-target nila. So para sa akin, bakit hindi na lang natin ilagay na sa DepEd? Kasi nga, pwedeng magtayo si NTF-LCAC ng school building pero hindi pala na program ng DepEd na may teacher doon sa itatayo nila. So for me, it's better na ilagay na lang sa DepEd. So that was my amendment for this year's budget. Pero hindi siya nasunod, di ba? And during the DBM budget hearing, they promised us that they will submit kung ano na yung progress report dito sa 16 billion fund that was given to NTF-LCAC. But I am sure for next year, talagang matatapisan itong 28 billion additional for NTF-LCAC.
Matatapisan, but are you expecting na babalik doon sa 2021 budget of, was it 17 or 19 billion? Or bababaan nyo pa ho? Do you want it even lower than the budget of 2021?
Ako, kung sa akin lang, Pinky, mas gusto ko nga mawala na totally yung budget for NTF-LCAC. Kasi nga for me, mas kalaban natin yung COVID than hindi ko sinasabi na wala tayong problema sa insurgency. Ang sinasabi ko lang, with the lack of resources, we need to prioritize, diba? And for me, dapat, kumbaga, all out muna tayo sa COVID kasi mas malaki, mas nakakasugat itong problema natin sa COVID-19. And remember, Pinky, hindi pa natin napag-uusapan for next year's budget. Walang ayuda na bahagi dun sa budget na yan. And 28 billion is a lot in our fight against COVID. Kasi nga, isa din sa nagiging problema ngayon, Pinky, marami tayong kababayan na even if they already feel certain symptoms, number one, na hindi nila ma-afford yung testing kasi mahal, di ba? And then number two, ang problema nila pag nag-positive sila, that's like minimum of 14 days quarantine. Some, pag naging mild or severe, it can go a month. Kung work, no pay ka, that's 1 month of not earning anything. So kailangan we need to craft something para to encourage them na okay lang na mag-patest ka kasi libre. Okay lang na hindi ka muna magtrabaho habang positive ka. Kasi tuloy-tuloy naman may makukuha kang ayuda na pwedeng ipakain mo sa pamilya mo. So this 28 billion can be used for programs like that.
I do hope, Senator, that you are able to craft, the senators and the congressmen are able to craft something to that effect. Dahil nga po, tama po yung sinabi ninyo eh. Ayaw na po magpa-test na natatakot mag-positive. Pag mag-positive po, at least 14 days na no work, no pay. Kung no work, no pay po sila. Sabihin po natin na gamit mo na yung VL mo o SL mo, regular employee ka, mauubos din, kakaltasin din po yun sa sweldo. Kaya malaking hesitation yon among the public na magpa-test. At syempre, nandun na nga po yung sinabi nyo, magulo din po kasi talaga who is eligible for free testing. That's a question a lot of people are asking. But Senator, unfortunately, we've run out of time. I was just going to even ask you quickly na lang po, ano hong plano ng una?
At the moment, hindi pa I suspended kasi yung talks on politics kasi nga during the time we search. But I think since the numbers are getting better, baka mag-uusap muna kami.
Okay.
Baka pwede na kami mag-usap kung where will una be for 2022.
Hindi ho ba sigurado sa Partido Reforma?
At the moment, wala pang gana. Hindi pa namin napag-uusapan.
Senator Nancy Binay, thank you so much for your time and take care.
Thank you. Ingat.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.